I am having severe hot flashes and vaginal symptoms. Should I take HRT? Will it help me? Is HRT right for me? Are there any risks?
So hello everyone, I'm Dr. Anjali Kumar. I once again bring greetings to you from Maitri. Maitri is a space where we talk anything and everything about women's health. So what is HRT? Hormone replacement therapy. So let's start with some basics. Hormone replacement therapy is a medication which contains female hormones, which is estrogen and progesterone. You take the medication to replace the estrogen which your body has stopped making during the menopause. So hormone therapy is most often used to treat common menopausal symptoms like hot flashes, mood swings, headache, vaginal discomfort, and it is also used to prevent and treat long-term complications of menopause like osteoporosis and cardiovascular complications. So what are the basic types of hormonal therapy? Now, hormone replacement therapy primarily focuses on replacing the estrogen that your body no longer makes after the menopause. There are basically two types of HRT. One is estrogen and progesterone, and second is estrogen alone. So, in case you haven't had your uterus removed, your doctor will typically prescribe you estrogen along with progesterone. Now, this is because in case the estrogen is given alone, which means when it is not balanced by the progesterone, it can stimulate the growth of endometrium, which is the inner lining of uterus, increasing the risk of endometrial cancer. So the progesterone, when it is added, reduces the risk of endometrial cancer by making the endometrium thin. Now, in case you have had your uterus removed, which means you have undergone a hysterectomy, now you don't need a progesterone. So you will be given only an estrogen. What are the benefits of taking an HRT? It reduces hot flashes, it reduces vaginal dryness, reduces risk of developing osteoporosis and reduce risk of breaking a bone. It improves the muscle strength, improved mood and overall sense of mental well-being in some women, decreased risk of tooth loss in a woman, lowered risk of colon cancer, lesser risk of diabetes, improvement in joint pains, and lower death rate for women who take hormone therapy in their 50s. Now, let's talk about what are the risks of hormone replacement therapy. Is it absolutely safe? So, there is an increased risk of endometrial cancer only if you still have your uterus and you are not taking a progesterone along with estrogen. Second, significantly increased risk of blood clots and stroke. Then, increased chance of gallbladder stones or maybe gallbladder problems. Increased risk of dementia in case the hormone therapy started after midlife. Increased risk of breast cancer with long-term use. But now we need to understand the context here is very crucial. So the type of HRT, whether it is just the estrogen or estrogen plus progesterone, duration, your own personal history, which means if you're obese, you're a smoker, you have a history of breast cancer, you have a history of clot formation previously, all of these play a role. So for best results, hormone therapy should be tailored to each person and re-evaluated every so often to be very sure that the benefits of HRT still outweigh the risks. Now, who are the women who should not take a HRT? Now, HRT is usually not recommended if you've had a breast cancer or an endometrial cancer, if you have any kind of abnormal vaginal bleeding, or if you've had blood clots or are at high risk of them, maybe if you're obese or you smoke, or definitely if you have a history of stroke, heart attack or increased risk of a vascular disease, if you know or you suspect that you could be pregnant, if you have some liver disease. Now, what are the latest guidelines and recommendations? So, listen to it carefully. This is important. Age. If the estrogen is appropriate for you and in case the HRT started before the age of 60 or within 10 years of hitting the menopause, the benefits appear to outweigh the risks. While if the HRT started after the age of 60 years or more than 10 years after the onset of menopause, then the risks are more. HRT is definitely indicated in case you've had an early menopause, which is 40 to 45 years, or a premature ovarian failure, which means the menopause happened before 40 years, or a surgical menopause before 45 years. What are the side effects of HRT? So, like most medications, HRT also has side effects. The most common side effects could be monthly bleeding. In case you have a uterus and you take cycled progesterone and estrogen every month, then you could be having bleeding when you stop it. Irregular spotting in between while you are on hormones. Breast tenderness, this happens because of estrogen. Mood swings, fluid retention, headaches, especially migraines. Skin discoloration, brown spots on the face, neck. Increased breast density making the mammogram's interpretation more difficult. Skin irritations in case you're putting a estrogen patch. How long should I take the HRT? In general, there is no time limit to how long you can take the HRT. You should take the lowest dose of hormone therapy which works for you and continue routine monitoring with your doctor to re-evaluate your treatment plan every year. In case you develop a new medical condition while taking HRT, see your doctor as soon as possible. Now, what can you do if you can't take hormone therapy? So, in case you are not a suitable candidate for HRT, then there are various other options. You may be able to manage the menopausal hot flashes with healthy lifestyle approaches such as keeping cool, limiting caffeinated beverages, alcohol, practicing relaxed breathing and other relaxation techniques. There are also several non-hormone prescription medications that can help relieve the hot flashes. I hope you watched our video on hot flashes too. For vaginal concerns like dryness or painful intercourse, a vaginal moisturizer or a lubricant can also provide relief. For complete information on diet and supplements during menopause, do watch our next coming video. So the bottom line is, HRT isn't all good or all bad. It's about making informed decisions based on the latest research. HRT can be a game changer and a powerful tool, giving significant relief and improving the quality of life. However complex this topic may seem, it is a decision not to be made lightly. So thank you for joining me today. If you found this discussion helpful, please like, share and subscribe for more health insights on all topics related to women's health. I'm Dr. Anjali Kumar, wishing you perfect health and happiness in your golden years. See you next time, and do not forget to like, share and subscribe and comment, and we will see you soon.